All right, today we're jumping right into the middle of a medical mystery. Think of it like a high-stakes puzzle. We've got a patient in crisis, a suspected overdose, and it's our job to figure out what's going on. So let's put on our detective hats and dive in.
Okay, so here's the situation. You're on the scene. A patient is agitated, their blood pressure's through the roof, their heart is hammering away, and they're burning up. I mean, what do you even suspect at this point? Your call could literally save a life. Let's start breaking down the clues.
So we're in the emergency room, and the first thing we've got to do is look at the numbers, right? The patient's vitals. These are the hard facts that are going to point us in the right direction. Okay, clue number one, agitation. And look, this is way more than just being upset or annoyed. Clinically, this means they're restless, they can't stay still, their entire central nervous system is just revved up into overdrive. So that's our first piece of the puzzle. All right, now let's look at the monitor. Whoa, blood pressure is 180 over 100. Just so you know, a healthy reading is usually under 120 over 80. So this is severe hypertension. We're talking about the heart working way, way too hard, putting a ton of stress on the whole system. That's a big one. That's clue number two. And then there's the pulse rate. It's clocking in at 150 beats a minute. Your resting heart rate is probably somewhere between 60 and 100. So 150? That's just dangerously fast. The medical term for that is tachycardia. And it's our third major clue. And finally, clue number four. You just touch the patient's skin and it's hot, really hot. This is a sign of hyperthermia, a super high body temp. It's like their internal thermostat is just completely broken, and they're basically cooking from the inside out. Okay, so we've got our four big clues. Any one of these on its own would be pretty worrying, right? But when you see them all together, they stop being random symptoms and start telling a very, very specific story. So let's line them up. We've got agitation, we've got hypertension, we've got tachycardia, and we have hyperthermia. You see the pattern, right? This isn't just a coincidence. Every single one of these signs is pointing in the exact same direction. The body is speeding up. It's going way, way too fast. And yeah, there's a name for this specific pattern. It's called a sympathomimetic toxidrome. Now, toxidrome sounds complicated, but it's really just a fancy way of saying a fingerprint, a collection of symptoms that points to a particular type of drug. And this fingerprint, it's practically screaming that we're looking at a stimulant overdose. It's like the body's fight or flight response has been cranked up to 11. Okay, so now we know what kind of culprit we're looking for, a sympathomimetic. So let's look at our lineup of the usual suspects. We've got four possibilities here. The real question is, which one of these fits the profile? And look at this. You can immediately see a clear divide. On one side, you have cocaine, which is a classic sympathomimetic, an upper. And on the other side, you've got heroin, Valium, and alcohol. All three of those are CNS depressants, or downers. And based on what we've seen with our patient, there's no way it could be a downer. It just doesn't fit. So we've got the evidence, we've lined up the suspects, and we've identified the pattern. I think it's time to make the call and close this case. And here it is, straight from the source. The patient's whole clinical picture is a textbook match for a sympathomimetic drug overdose. And when you look at that list of ours, cocaine is the only sympathomimetic on it. That's our answer. But hold on a minute. It's not enough to just know the right answer. To really get this, we need to understand why the other options were so wrong. This is where the real learning happens. Okay, now this is really the key to the whole thing. Just look at the difference. Uppers cause agitation, downers cause lethargy or even a coma. Uppers give you sky-high blood pressure, hypertension. Downers cause it to crash, hypotension. Uppers a racing heart, downers a dangerously slow one. One makes you hot, the other can make your breathing so slow and shallow it's barely there. They are literally medical polar opposites. So let's zoom out from our single patient case for a second and look at the big picture, because this was the one concept you really need to walk away with. It really boils down to something this simple. Sympathomimetics, the uppers, they slam the gas pedal on the body. Everything speeds up. And CNS depressants, the downers, they hit the brakes hard. Everything slows way down. One is the accelerator, the other is the emergency brake. And why is this so critical to know? Because in a real-world emergency, you can't get this wrong. The way you treat a body that's in overdrive is completely different from how you treat a body that's shutting down. Making that call correctly and quickly is what saves lives. It's that simple. So now you can spot the signs. You can see the pattern of an upper versus a downer. But that just opens up a whole new question, doesn't it? What's actually going on inside the brain with all the chemicals and receptors to cause these two completely opposite effects? Now that is a whole other mystery.